So my name is Dr. Niravath. I'm a breast oncologist at the Houston Methodist Neal Cancer Center, and I'm the section chief for breast oncology. I'm also a clinical researcher. So I came to the San Antonio conference this year to present some of the research that we have that I'm really excited about. One of the trials that I just presented was in a special population of breast cancer patients, which is specifically triple negative metaplastic breast cancer patients. This is less than 1% of the entire breast cancer population. And the reason why they're so unique is that it's a totally different etiology of breast cancer. So they don't really respond to the same chemotherapies and targeted therapies that we use for most breast cancers. So in our research, we found that two of the main drivers within metaplastic breast cancer, which are really unique, are inducible nitric oxide synthase, and another one is called a PI3 kinase genetic mutation. So this trial actually specifically combines a very gentle chemotherapy called nab-paclitaxel or Abraxane with two other drugs that are targeted. One drug that specifically inhibits this nitric oxide synthase, and then another drug that specifically inhibits PI3 kinase. It's called alpelisib. It's a pill. So this combination of the three drugs, the chemo and the two specialized inhibitors, was really remarkable. So in metastatic patients, we saw a benefit rate of 77%, which is kind of unheard of because typically for metaplastic patients, we're seeing response rates in the range of maybe like 10 to 15%. So it seems like targeting with these specific agents for this unique type of breast cancer really seems to give patients good benefit. So actually, the normal standard of care at this point, because we don't have anything differently for metaplastic breast cancer, is to get the same chemotherapy that triple negative patients get. So in this case, we're actually potentially saving them from getting a lot of other toxic chemotherapies that we use in triple negative patients. So we're able to de-escalate the chemo and really focus on the targeted agents. Because yeah, this is a much gentler chemo than what they would typically get if they had triple negative breast cancer. I think the thing that was the most remarkable was that so this was a phase 1B portion. So meaning that we found the maximum tolerated dose with this portion of a trial that we just completed, and now we're going into the phase 2 portion. So this phase 1 portion was only 9 patients, and within those 9 patients, 4 out of 9 of them had a PI3 kinase mutation, which is actually very high for most triple negative breast cancers. So it's telling me that metaplastic breast cancer most likely is really driven by this PI3 kinase mutation, and using this specific inhibitor, alpelisib, seems to really boost responses in a way that chemotherapy just cannot do. Yeah, so right now we're going into phase 2 of the same trial, and we're opening it at other locations. It's been so successful that we're going to be opening it at 2 additional locations. Aside from Methodist, we'll also have it open at MD Anderson as well as the NCI. And that way patients from all over the country, hopefully, can find locations that are convenient, or at least more convenient for them to go to. Well, so all patients, when they have their biopsies, they would know if they have triple negative breast cancer and they would know if they have metaplastic breast cancer. But this extra testing, this PI3 kinase, is not necessarily done for everyone. So your doctor has to specifically request that. So that's kind of a good tip for some patients out there, especially if you have an aggressive type of triple negative or metaplastic breast cancer. It's a good idea to request this type of genomic testing so you can find out if you have a PI3 kinase mutation. Yeah, I mean, absolutely. Because what we're seeing is that actually in triple negative breast cancer patients generally, even those that are not metaplastic, we're seeing that nitric oxide is actually a very important driver for those breast cancers as well, for a certain subset of them. So we're looking at the next phase eventually at having triple negative breast cancers that we can test. And those that are amenable to this treatment, we would actually be able to give this same 3-drug treatment to them. And that would help increase our patient pool. So meaning 10 to 15% of all breast cancer is triple negative. So that would really allow us to help more patients with this approach. The conference has been fantastic. Yeah, I really enjoyed it. It's always fun. It's a lot of networking and learning so much constantly. One of the trials that I was excited about was presented today. It's called the Ensema trial, because in that one, they're actually omitting sentinel lymph node biopsy for patients with small, early stage, non-aggressive breast cancers, which I think is going to be tremendous for patients. Not everybody probably needs a sentinel node, so I think it's a long time that we found out who we really need to do that for versus who we don't.